Now we've got all three disciplines looking at the same piece with different lenses and being able to say, I think we need to work on this goal, and then that's going to achieve a more successful latch because they have less tension in their cheeks. They're able to get full rotation of their neck, and now we can latch, and that lactation consultant can really actually work on the latch with mom and positioning and all of that, because baby is now able to actually anatomically achieve a head tilt and a gape. And we're just having these moments every single time that we work together.
Before we begin, I want to share something special with all of you expecting parents out there. As an internationally board certified lactation consultant, I've seen firsthand how a little planning can go a long way to helping you achieve your baby feeding goals. That's why I'm offering you my free ebook. It's called Birth Practices to Support Breastfeeding, and it's a workbook. So check out the link in the description below. If you have been in a situation where your baby was struggling to breastfeed, then you know that sometimes it takes a team to help your baby to achieve great oral motor function and be able to transfer milk from your body. And in those early postpartum days, every extra appointment you need to make feels nearly impossible. So that is why I am so excited to share this interview with Rachel Best. She was on last week talking about her personal baby feeding experiences, but she's also an SLP and an IBCLC who runs a few clinics in both Massachusetts and Rhode Island, where they use a collaborative model to really help babies achieve greater oral motor function and to help parents to know the best way to help their kiddos. So enjoy. Hi, Rachel. Welcome back.
Hi, Lo. Thank you for having me again.
Yes. Okay. So you were already on to tell your baby feeding stories. So that episode is available for people to listen to. I'll have it in the show notes. But you are also a speech-language pathologist, an SLP, and you focus on infants. Well, you do the whole range, don't you? You do all ages.
So I'm
Okay.
a speech-language pathologist, a certified orofacial myologist, and as of last month, an international board certified lactation consultant.
Congratulations! I
Yeah.
didn't know you were sitting for your
I did.
exam. That's so
And I passed
exciting.
by the grace of God. That was a rough one, but it was
Yeah.
fabulous. I'm very excited.
Awesome. Yeah, that is so exciting. Yeah, and you have a private practice with multiple locations.
3 in Rhode Island and 2 in Massachusetts.
Wow. I didn't realize it was that
Yes,
many.
yep, 5 clinics right now, and yeah, always growing, always the more you learn, the more you realize you don't know, and the more specialists you need to bring on board, and yeah, it just keeps growing.
I love that. Yeah, that's great. And it's called Small Steps
Yep,
Therapy.
small steps therapy. We've been around since 2013, so once I started having children, I was working in first a hospital and then a school, and it was really hard to keep up with the schedule. So I decided at that point to open up my own private practice so I could make my own schedule and kind of really specialize in feeding, which I've always loved and had a huge passion for. But at the school, obviously, it's much more difficult to specialize in that population. So yeah, so that was about 11 years ago, and here we are now with 5 clinics, 40 different clinicians. Yeah, just helping as many
Wow.
people as we can.
Yeah, that's incredible. And are you in network with
We
insurance
are. Yep.
companies?
Yep. You take
Okay.
some Medicaid, all the standard insurances for the most part.
Okay, that is fantastic. So people can go get insurance covered care from you have SLPs, speech language pathologists,
Yep.
IBCLCs,
Occupational
OTs.
therapists, registered dietitians, and in Rhode Island, we even have a floor time therapist who specializes in, playing with kids and teaching parents how to interact with their child who might be neurodivergent.
Wow.
Yeah.
That is so cool. Okay, so you hear about this. I met you actually at a gathering of people who want to learn more or work with populations of mostly babies with tongue tie. And when I first heard about your practice, I didn't know about your practice before, even though there's one that I can refer people to in Massachusetts. I was just blown away at the idea that there was one place where people could go to get all the care they needed. Before we started hitting before we hit record, I talked about how it's so challenging for a parent when they finally gotten the appointment with the IBCLC. We'll say it starts with an IBCLC, but for other people, it might start with a dentist or start with maybe early interventionists say, "Hey, you need some more help. You should reach out to somebody." But then it kinda stops there. It's up to the parent to then make the appointments and figure out who it is they wanna go see for the care and whether or not insurance will cover it. So tell me a little bit about your vision of how having this coordinated care can improve outcomes for babies or for children and help getting that care be less stressful for parents.
So I've always been a feeding and oral motor based therapist. So I would say maybe 7 years ago, as more and more providers were noting tongue ties, releasing tongue ties, families started seeking out that post op care. So then they started finding me, and I was treating all of these babies who either were going to have a release or had had a release, and we were having great results. At the same time, I was also expanding the practice to include more OTs. And one of the OTs that I hired, who is my dear friend today, Jamie, shout out to you. She also enjoyed working with kids who were kind of going through tongue tie releases. So I would see a baby, they would have great success with their oral motor skills, but still something wasn't quite right. So then I was constantly like yelling out the door, Jamie, can you just pop in and look at this baby? And, they would have those curled toes and their fists were all tight, and we would notice the head tilt to one side, and we started taking some data and noting that about 95% of our babies who had a tongue tie had torticollis. So we've really been looking into that whole body connection. The tongue is literally connected to the toes through fascia. So it's not just working on the mouth or just working on the latch. We really need to address the entire body so that these babies really can feel good from head to toe. So that was a huge game changer for us. And then we started working with a dietitian. I have a cousin who is the world's best dietitian. She lived in Connecticut, and I just for years kept begging her, please come to Massachusetts and Rhode Island. I need you. We need your guidance. All of these babies that have weight gain issues, it's not within my scope of practice to address that. I'm working on the mouth. Jamie's working on the body. We need you to help us. She's also a lactation consultant. So finally, we got Alyssa, shout out to you, join the team, and it was just the 3 of us seeing all these babies. We would take a whole day of the week and just see as many kids as we could all together, which is a huge game changer
Oh,
as a
wow.
professional to be in the room all together. So we would
Yes.
be the baby would go to feed, and Alyssa, the dietitian, would say, "Well, they're really not tilting their head back." And then Jamie would say, "Well, they have a lot of tension in their neck. I don't think that they can tilt their head back." And then we would say, "Oh, they can't open their mouth wide for that gape." And I'd say, "Well, their cheeks were so tight. I don't know that they could achieve that." So now we've got all 3 disciplines looking at the same piece with different lenses and being able to say, I think we need to do this. We need to work on this goal, and then that's going to achieve a more successful latch because they have less tension in their cheeks. They're able to get full rotation of their neck, and now we can latch, and that lactation consultant can really actually work on the latch with mom and positioning and all of that because baby is now able to actually anatomically achieve a head tilt and a gape. And we're just having these moments every single time that we work together. So here we are 7 years later, and every clinic has a baby team. We've trained multiple therapists to do the work that we're doing. You don't get this training in graduate school. It's all additional education that we've all sought out or that we've learned from each other. We love going on the road and speaking at conferences and sharing what we've learned as a team because I don't know anybody else who is working this closely with an entire disciplinary
No,
team, so it's fabulous.
no. It's revolutionary, yeah, and I think about how many times I'm seeing a baby and I think, "Oh, I would love to
Yeah.
ask." somebody about this head tilt, or, and I'm constantly saying it's not within my scope to diagnose
Yes, yes.
torticollis, or it's not within my scope to, but here's what I'm telling you that I'm seeing, and I think you would really benefit by going to see somebody. But, parents don't always understand the intricacies of the various scopes of practice, and nor should they. Like, I don't always understand what an SLP is doing or an OT is doing. Um, However, I know that the work that I'm doing could be greatly
Exactly,
benefited
yeah.
by having these other practitioners in the room. And I think it's a great point that you bring up, that you didn't learn that in graduate school, because I always tell my patients no discipline has enough tongue tie training as just a standard part of their degree or their certification. So if you are going to seek out help for a baby who has tongue tie, you need to go to people who have intentionally sought out additional training. And that could be any discipline, right? If you find a great SLP who's really good at tongue tie, they might be able to really get you far enough to meet your goals. Same with an OT, same with an IBCLC, same with a dentist. But if you go to somebody who just will is going to look in a mouth and say yes or no, you have tongue tie or you don't have tongue tie, that's not going to be what meets many
And
people's
finding a
goals.
provider who is willing to meet with and discuss all of the different disciplines concerns. There's so many providers out there that I really struggle with who are just like, "Oh, you just need to see me, I've got all the answers." Like you just said, nobody has all of the answers, and if a family is investing this much time, money, and effort into treatment, we need to, as medical providers, all be on the same page and willing to collaborate and reach out because, I'm always going to be a speech-language pathologist and a feeding, swallowing specialist first. That is my number one thing, even though I have all of these additional letters behind my name and I've done all this other training, that is always my primary lens, and if I have a baby who needs really significant lactation support, I'm going to send them to Yulo or to somebody else who can really work on that sole piece, or if we need the chiropractor, or if we need a physical therapist, whoever it may be, we all need to collaborate and work together because like you said, I've got one lens on, and that's the lens I need to wear to really be good at my job, but I need you, I need the PT, I need the dentist, the ENT, whoever it may be, to be willing to chat with me about, "Okay, this is what you're seeing, this is what I'm seeing. Oh, let's put these pieces together," and really, now we have a complete picture. It's never just one thing, it's always multiple complex body systems that are working together to help or are not functioning properly.
Yeah, and this might be a little of a nerdy deep dive, but I'm gonna ask it anyway, and we can decide whether or not parents will benefit from it. I can feel and hear the conflict in parents' hearts and minds when, when I tell them, this is a complicated issue. You're going to need multiple people to help you. And they're thinking, why is it so hard to feed a baby from my body? Why does it take so many professionals from so many disciplines to help my baby feed? And there's a fine line between recognizing the difficulties that the babies are having and pathologizing this new little
Yes.
infant who is just learning their way in the world. So, how do you help people to understand the reasons why so many infants are having so much difficulty with feeding from the body, feeding, breastfeeding?
I like to go back as far as we can in history and talk about the things that have changed. Was it always this much of an issue, or is tongue tie just something that's coming up now? And like really going back in the literature and understanding, especially here in this country, our culture and what has gotten us to this point. It was very different 200 years ago when midwives were always there and people had that support. And, we have a lot of research and documentation on the tools they would use for during that tongue tie release right after a baby was delivered and what the midwife would do, and then that baby's feeding story and all of that success and support that that family had. And then, in this country when midwives were no longer permitted to even treat and everything became very sterile and hospitals and, then formula was developed. And, at this point, we're just a completely different culture and the priority is no longer on mom and baby. It's more on the medical system and the research and the best science that we had in that day. And, it's an unfortunate thing looking back now, but hindsight is always 2020. That's just where we were at that time. And then, in the 80s when both of us were born and there was finally that push back to breastfeeding, and then now here we are in 2024, and we're finally starting to realize, oh, like all of these things that we've missed, all of this time, all of these
Mhm.
airway issues, just bottle feeding and forcing formula on all of those babies, all of those years, we did pay a price and we are finally making some progress and understanding that. And, it's not tongue tie is not a fad. It's just something we've been ignoring because we've been encouraging families to bottle feed and formula feed. And, finally, we're in a place in our culture where we're listening to women and listening to their pain and, hopefully providing some support. So it is a tricky situation for
Yeah,
parents, and it's especially tricky when all of their providers aren't on the same page, but just trying to give them as much information, as much of like, this is the story behind some of this. This is where we are as a culture. It's not you, it's not your baby.
mhm.
It's, we're humans, we make mistakes, so we have journeys, we're constantly learning new things, and sometimes we learn that what we learned 20 years ago was not as accurate as we wanted it to be, but, we're all doing the
Right.
best we can with the information that we have.
Yeah, exactly. That's a great way to put it. It's not a thing of blame. Nobody wanted babies and moms to be in this situation in 2024, but that's how it happened. And I also think when you talk about helping moms to really get a good latch and looking at all the pieces, is it the neck? Is it the cheeks? Is it, full body tension all throughout? These things, a lot of parents think, okay, well, if my baby can't achieve these things and they need all these specialists to help them get there, then maybe it is best for my baby just to switch to bottle feeding. But as you're saying, that exacerbates the problem and then we end up with swallowing difficulties. Or I am 43 years old and have been diagnosed with sleep apnea because I did not have the right type of feeding journey to begin with, which develops the cheeks and that suck, swallow, breathe coordination. And my musculature wasn't developed properly. And we also know that there are epigenetic
Yes.
changes now
Yes.
happening with our
Oh,
jaws,
yes.
right? So some of that is just humans have different jaws than we did before. So it's not just about achieving breastfeeding. It's about what is the
Exactly.
long-term health of this baby, and none of us have crystal balls. I always tell my parents that when they're trying to make decisions about whether or not they should release a tie or whether they should go to specialists, I say, "In the end, you have to make the best decision with what you know now, and none of us have a crystal
Yes.
ball. We can tell you what we think could happen, but in the end, we really don't know, and so you just have to do the best you can with the information you
Yeah,
have."
and we can try to predict even, my oldest is has every symptom I feel like under the sun of tongue tie, and according to his dentist, his tie wasn't even that significant, but he had picky eating, he was always vomiting because food wasn't the right texture, he never slept, he had a really hard time with potty training, and it wasn't until we did all his oral motor work when he was 9 and had his tongue tie released and did his paddle expansion that we were finally able to make some good progress. And then my middle child has, maybe a more significant tie according to measurements and things, but she doesn't have all of these symptoms. We just don't know. We don't know.
Yeah. I think that's a what you're bringing up is a really good point. I always tell my patients, tongue tie diagnosis is a symptomatic diagnosis. It is not just a visual or textile, feeling in the mouth and looking in the mouth. It is tracking all of the symptoms. So in a baby that is How is the baby doing? You know, what kind of tension does the baby have? Are they vomiting a lot? Do they struggle in the car seat? Do they look like they have really good head control at a really early age? Are they transferring milk well? Is it dribbling out of the side of their mouth? And then we look at the parent. What do the breasts look
Mhm.
like after feeding? What does the nipple look like?
Yes.
Are you in
Is there a lot of
pain?
gas? Are
You
babies
know?
uncomfortable? And
Right. Are you super engorged, all the time? Or do you have really low milk supply? Because we see both ends of the spectrum, right? We see high milk supply and low milk supply with these tongue babies. And then we look at the feeding. What is going on during the actual feeding, in addition to the oral motor assessment? So if you are going to a provider and all they're doing is putting
oh
on some
gosh, yes.
gloves and looking in the baby's mouth, and telling you, yes, there's a tongue tie, or no, there's not a tongue tie, or yes, there's a tongue tie, but it's not severe, but you're experiencing all these severe symptoms, that person does not have enough
No,
training in tongue
no.
tie to really give you the help you
Yeah,
need.
and just make the referrals too, right? Like that's my biggest issue these days. It's just if you don't have the additional training, you just make the referral because, you and I are doing that functional assessment. We are actually looking at the functional skills. We are not diagnosing a tongue tie. We are just saying, this is where this
Right.
person is at this moment in time, and these are the skills that they need to develop to have a successful feeding journey, growth journey, developmental journey. Why are we gatekeeping? Let's just work together and
Yes, exactly. Okay, so you have this ideal situation, 5 clinics with all of these providers working together, sharing notes, coordinating care. But let's say there is a parent in a situation, there's not a small steps near them, and they cannot get all of that coordinated care together. What advice would you give them to try to find practitioners who are willing to work together and to help them to coordinate care? It should not be the parent's job, but if so many people are in this situation where they're just seeing these different pieces of the puzzle, and the pieces aren't coming together ever. So what advice do you give to parents who are in that
and
situation?
it's so much easier than it was before because everybody has websites now. So I would say really look at a provider's profile, and don't be afraid to reach out to them and just ask, "What is your training? What do you specialize in? Do you have a body worker that you work with? Do you have a lactation specialist that you work with?" You're just trying to find out who is in their network and what their specialties are. So really asking that question and, I think a lot of providers it's tricky to have this transdisciplinary practice from an insurance perspective. It's not always easy and it's hard to find the providers. So just asking those questions, there's a lot of people that I know that do work together, maybe across practices. Maybe this one OT clinic works often with this speech clinic. So things like that, just asking their referral network, are they willing to collaborate with, if you have a lactation provider already, are they willing to collaborate with them? Because that's always the number one thing I want. I wanna connect with that IBCLC and say, "Great, what have you been working on? Okay, I'm gonna do this differently. I don't want any redundancy of care because that's not fair to that family." And, time and money are precious, and I want to really be respectful of that.
That is so true. And I'll say that one of the things I've done for patients is say, I know this craniosacral therapist, or I know this chiropractor, or I know this SLP. Would you like me to send the notes? I'll send my notes, and I let them know, hey, if you have any questions, call me. And then there have been a few times where we have coordinated. I do in-home visits. So we've coordinated the in-home visits. So I'm going to come and another practitioner is
Yes.
going to come, and we're going to work together at the same time. And so if you are seeing multiple people as an IBCLC, if you are going to a chiropractor and that chiropractor that, most chiropractors aren't going to do home visits, I'm happy to meet you at the chiropractic
Yeah.
office. Like let's meet there. Let's schedule our appointment for that time. And that way I can see the feedback that your chiropractor is giving and I'm learning from them
Yes. Yes.
simultaneously. It's a good opportunity. But then you and I, all it takes is calling the chiropractor and saying, "Hey, I'd love to do a lactation visit with this person. Is there a space we can have after you're done with your work?" And more often than not, they are going to try to
Yeah,
accommodate
I've
that.
never had anybody tell me no. I'm sure there's people
Yeah.
out there that would, but, you know those are not the
Right.
providers that we would recommend seeing anyway. We need to understand that we don't know it all and we need each other. So, yeah, I've been in multiple chiropractors' offices. I've gone to the dentist many times, been there for the release. It's
Mhm.
helpful.
Yeah, and that helps the practitioners. Don't be afraid to ask other practitioners if you can coordinate care, if you can come when your patient is coming, and it might be that you need to do that on your own time as a way of building connections, like, maybe you're not gonna be able to bill that visit if you're not actually providing care, but it will have long-term returns on your practice because then you're gonna be the person that that provider
Yes.
calls when they know that somebody needs a visit
Yes,
with you.
absolutely. We need every
Awesome. Well,
we
what's
need
that?
everybody. We need everybody on the same page
I
willing to
know.
collaborate and support these families.
I know. I wish that there was a small steps therapy, like, in every major area because having one place where people can go is
Yeah,
incredible.
I'm working on it. Yeah,
Yeah, I can see that.
I'll work on it. Yeah, y
Come up to North Central Massachusetts.
yeah, we're getting close. We're in Central Mass now, so we're getting closer.
I know.
Yeah.
Yeah, yeah, exactly. Awesome. Is there anything else that you feel like we didn't cover when it comes to this coordinated care that you feel like is important to discuss before we wrap it up?
I think as the family, make sure you know your insurance benefits and your questions. Make sure that you know if you have copays and deductibles because it's not a perfect situation. There are times when, we'll have 3 copays and things like that. So just know your benefits, know your patient rights, know what questions to ask, and don't be afraid to ask a lot of questions because it only benefits all of us.
Right, exactly. So thank you so much for taking the time to share your expertise with us and your personal story as well. I really appreciate the care you're providing to families on the East Coast, and I'm so excited to see what else happens with small
Awesome.
steps.
Thank you so much, Lo. This was so fun.
Awesome, and all your links will be in the show notes, so if anyone wants to reach out, everything will be
Awesome.
there.
Thank you. Thank you, everybody.
So there you have it. A team of practitioners that include speech-language pathologists, occupational therapists, IBCLCs, and others to help ensure that babies and parents can breastfeed and meet their baby feeding goals. And I feel so lucky to be in an area where I know so many great practitioners who refer out to each other. We know our scopes. We know when we can be the person to help a family and when somebody else needs to tag in and help a family to understand what's going on and why breastfeeding has become so difficult for them. So if you are struggling to feed your baby, please reach out. I would love to be the person to support you or to refer you out to whoever you may need to see to achieve your goals.